Hi, this video is going to cover any advice that you were given during your mummy MOT for your bowel, your bladder and your pelvic floor. The first thing we're going to look at is your bowel. The bowel is super important because if you suffer from any form of constipation, you are going to struggle more with leaking because there's very limited capacity in the pelvic bowl, and if the rectum is full, there's more pressure on the bladder. So it is important to make sure that you get enough fiber. I'll cover how to do that in your nutritional talk, and make sure that you get enough water to make sure that you have regular bowel movements. Once or twice a day, even more than that is good. If it's less than once a day, we're looking at a slight problem. So we need to check that that is sorted first. If you have a rectocele, I would have given you some advice as to how to splint that in clinic. Key thing, I'm going to show you on a model now so you can remember, is to make sure that you're splinting the rectum. So when you've had a rectocele, the rectum is pushing forward into the vaginal floor, so you'll have the stool sitting in the vaginal space. So what you want to do is use your thumb to come up into the vaginal space and push back and down so that you are supporting the posterior pelvic vaginal wall and supporting those tissues there. And that'll help you to get the stool out without any problems and any straining. The other thing to do is to make sure that you're in the correct position. So I would have recommended something like a squatty potty, but any stool is good to get your knees higher than your hips. You want your pelvis to be in a posterior tilt. It releases the levator ani muscle that holds the sphincter so that you can let go of the bowel movement when you need to. So feet are up in a stool, no straining. The breath you want to be using here is a long, slow out breath. You can either use a or but you want to make sure that you don't stop the air from flowing through your throat. So you don't want to stop and bear down. That is very bad for the pelvic floor and can lead to prolapse later on in life if you don't already have one. So to support that, you make sure that you're breathing out fully, and you can just keep breathing out as far as you can. Nice soft in-breath, long slow out-breath. That will help the pelvic floor muscles to contract and to aid the evacuation of the stool that you've got, especially if you're splinting as well. There are some tools on the market. One's called Femis that I quite like. This little spatula. If you're not comfortable using your thumb internally, but I do recommend that you at least have a go so that you know what you're feeling for before you start using a tool. So that is the basic bowel. The other little thing that you can do is an I love you massage if you struggle with constipation. Similar to what you might have been taught for your baby, you start with the left side, push down towards the hip. Then you can do 3 or 4 rounds of that, or even more if you feel that there's a lot of stuff stuck there. So nice and soft, you do this lying on your back, knees bent, and just get some massage down there. Then you come across, just clear that, and then you do the L. So that would be your I, that would be your L, from the right rib, left rib down to the left hip. And then you come up again, clearing up, and then you can come up from the right hip, right rib, to the left rib, to the left hip. That is your U. So you do your I love you massage there, and that will help to get things moving as well for you.